Hello, everyone. Welcome again to VMC Coding Learning Session. There you go. Um, Again, this is Eli Rada. I am your medical coding instructor. I am a certified trainer for medical coding, for ICD-10, and also for clinical documentation improvement. Today, guys, I pick a topic that also people come up to me and asking, how do you code it the right way? So today, guys, we are going to have a discussion about how to code AIDS or HIV. Are you ready? Okay, so let me go to my presentation. So coding AIDS, HIV, everybody knows what HIV is, right? I mean, is there anyone here that doesn't know HIV or AIDS? It is a viral disease, right? We just had, of course, everybody had a horrible experience about COVID, right? So this is a different one. AIDS, I think it became very, very popular in the early 70s, was it, or early 80s? I don't exactly remember when this became, gain when this gained notoriety, because I remember back then, if someone who is infected with AIDS virus or with HIV virus, it's almost like a death sentence, right? So I remember that era where people are really, really scared of AIDS. People are still are nowadays scared of AIDS, but AIDS right now, guys, per my experience, when I review medical records, I see people who have contracted this virus, and people now live a longer life compared to when AIDS was newly discovered back in the day. But of course, uh, there are rules or coding rules that were put in place for us to be able to capture the true clinical picture of AIDS in terms of documentation, and that's what we're going to talk about. Okay, so I assume that everybody knows what AIDS or HIV is. Okay, now let's go to our presentation. AIDS versus HIV. Is there a difference between these two? Now, this narrative, guys, came from or straight from the coding guidelines. I'm going to read Section 1, Chapter 1A, dot 1, code only confirmed cases. And it goes to explain here, code only confirmed cases of HIV infection, illness. This is an exception to the hospital inpatient guidelines, Section 2H. In this context, confirmation does not require documentation of positive serology or culture for HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV-related illness is sufficient. Too wordy, right? Too many words, too long of a narrative, but what does this really mean? Okay, it started with this statement that says code only confirmed cases. This is in reference, guys, to a scenario or incident when a patient goes to her private, well, not private, to her primary provider, okay, primary care provider, and and eventually the primary care provider had um, diagnosed the patient with HIV or HIV positive. Now, the statement that says code only confirmed cases applies to the specific scenario where the doctor still needs to run more confirmatory tests or needs to order, not the doctor, but of course, he needs to order confirmatory tests in an outpatient setting. So when a patient goes to to their PCP, the assumption is the PCP only sees the patient for a specific time window, right? Like maybe 20 minutes or 30 minutes the most. And after that encounter with the provider puts in the documentation that patient is HIV positive. Now, here you are, the coder. You look at the documentation and you saw the patient, the doctors reported HIV positive. Okay. Now, this is now where the statement applies that code only confirmed cases. HIV positive in the outpatient setting, guys, does not necessarily mean that patient has AIDS. That's what it means, okay? So I know for sure that if the doctor declares that the patient is HIV positive, the doctor will order more confirmatory tests, will probably send this sample blood work to other laboratory like reference lab, not conference, reference laboratory to do some more testings if this HIV positive is confirmed, is affirmative, right? Because this is a condition that should not be taken lightly. The doctor needs to be 100% certain, needs to be 100% sure that patient is AIDS, has AIDS or is very much positive HIV. That's what the statement says, code only confirmed cases. So in that case, guys, if you're the coder, if you see in the first encounter the doctor documents HIV positive, do not code it as AIDS. There is a difference between AIDS code and positive serology. There is a very, very big difference. So I hope that is clear. Now, I know for sure that this is going to be tested. A series of tests will be performed in order to make that confirmation that patient is indeed has AIDS. What else? Now, there is a follow-up statement here that says there is an exception. Look here, guys. Do not use. Oh, hold on one second. Did I correct? No. Okay, so I went one slide in advance. Okay, let's go back up here. It says here, this is an exception to the hospital inpatient guideline. Section 2, in this context, confirmation does not require documentation of positive serology or culture for HIV. The provider's diagnostic statement that the patient has HIV is sufficient. Now, what is the guidelines trying to say here? It's kind of like contradicting itself, right? So here is the reason why the outpatient encounter is different from the inpatient encounter, guys. Okay, in the outpatient, you remember what I said earlier, that the doctor's encounter with the patient would probably last 20 to 30 minutes, because outpatient encounters, guys, doctors are expected or would see other patients during the whole day. The guidelines that says do not code, only code confirmed cases in the outpatient setting, because they understand that you cannot, if you're the doctor, you cannot make a 100% confirmatory statement saying that patients has AIDS in that short window, like 30-minute evaluation. It's impossible. Okay, but in the inpatient setting, if a patient gets admitted in the hospital, patient will have to stay at least a day or two, right? A day or two, or maybe even more. Like if a patient is admitted with AIDS or HIV, chances are patients will probably stay longer, like let's give it like 3 or 4 days, depending on how bad this patient's condition is, and a patient has AIDS. So in that case, guys, there will be testings, or there will be confirmatory tests that will be done while patient is in the hospital. So when the doctor says in the inpatient setting, if the doctor discharges a patient and in the documentation, the doctor declares patient has HIV, you don't need confirmatory tests, guys. You code it as HIV or you code it as AIDS, right? So that's how you treat this two different encounters, the outpatient and the inpatient. Let me repeat. In the outpatient, code only confirmed cases. in the inpatient, even if the doctor says patient has HIV, you don't need confirmatory tests because it already have been tested. It is assumed that during this entire stay, like 3-4 days, that the patient is in the hospital, those tests were already performed. A lot of resources had already been spent to look at the patient's real condition, the true clinical picture, and chances are a doctor had already ordered those series of confirmatory tests to confirm the AIDS or the HIV. Okay, known HIV or HIV positive. Let's read this. Asymptomatic human immunodeficiency virus. Asymptomatic human immunodeficiency virus infection status is to be applied when the patient without any documentation of symptoms is listed as being HIV positive. Known HIV, HIV test positive, or similar terminology do not use this code if the term AIDS or HIV disease is used or if the patient is treated for any HIV-related illness or is described as having any conditions resulting from her HIV positive status. Use B20 in these cases. Okay, let's write those codes, guys. B20 versus Z21. We're talking about AIDS or HIV. Okay. So what we just read, guys, from the guidelines is that how do you treat or how do you code a patient who is HIV positive but is not showing any signs of being sick? Patient did not have any history of hospitalization. Patient did not have any history of getting sick for any HIV-related illness. So what are those possible HIV-related illness like pneumonia, cancer, respiratory failure? I'm just throwing throwing out there those conditions, guys, but there could be many more like Kaposi sarcoma. So there are different HIV-related illness that the patient may catch. Okay, if a patient is HIV, suffering from HIV or has AIDS. Now, the question here, or the issue here, what if the patient is not showing any of those signs and was diagnosed previously as HIV positive? What code do you apply? The guidelines said, let's go back what the guidelines say. For asymptomatic human immunodeficiency virus, is to be applied when the patient without any documentation or of symptoms is listed as being HIV positive or known HIV or any of these similar terminologies. What is the code? This is the code, guys. The Z21. Okay. Can you guys think of anyone who is described here? The kind of person, the person who is, I know a celebrity who came out, from way back then and declared that he is HIV positive. But seeing this celebrity, guys, this very known person going around without any signs of the virus HIV being active, because this person is strong as a bull, right? Very, very healthy looking guy. So the code that applies to a person who is HIV positive but does not have any sign or symptom of the virus being active, Z21. Okay. Now, there is a follow-up instruction here saying, do not, okay, so do not use this code, the Z21, Okay, this is in reference to this one right here, the statement. Do not use this code if the term AIDS or HIV disease is used, or if the patient is treated for any HIV-related illness. So the HIV disease and AIDS, right, they mean the same thing in terms of the coding language here. But if you see that in the documentation, doctor says HIV positive or known HIV without any sign of symptom, Z21. But for person who has AIDS confirmed already or has HIV disease, what is the code? B20. Okay, so let me go back to the board, guys. This guy here is asymptomatic, no signs or symptoms. While this guy here, okay, is symptomatic, meaning he has all indications that patient has AIDS, right? Very weak, the immune system is, is so weak that patient becomes immunodeficient, catches any type of disease out there, okay, because of the weak immune system. This is the person, and the code is B20. So any questions? So if you guys have any questions, by the way, you can leave a comment or question in the comment box. Make sure to message me, guys, and I will respond to that question the best I can and the soonest possible time. What about, okay, here is another scenario. What about, let's see here. So we already know the difference between asymptomatic and symptomatic. Let's see here. Patient admitted for HIV-related condition. Let's see here. All right, so maybe the picture does not very fitting for an HIV-related disease, but it can be like if a person's bone structure, skeletal structure becomes weak because of the virus, then this picture is related. Now let's see here. If a patient is admitted for an HIV-related condition, the principal diagnosis should be B20. So we're talking about now what should you assign first, okay? And the guideline said you should assign B20 code as your principal or first listed diagnosis. Okay, this is your HIV, followed by additional diagnosis codes for all reported HIV-related conditions. Now, there is an exception. Exception to this guideline is the reason for admission is hemolytic uremic syndrome associated with HIV disease. Assign this code, D5931, followed by your B20 code. Okay, let's go to the board again and let's try to unpack this or break that down. Let me erase the board, guys. So here's a person who was admitted with HIV-related disease. Okay. Now, the guidelines are very clear that if the patient is admitted with an HIV-related disease, and what are those diseases, possible diseases that like I have enumerated earlier, pneumonia, right? The patient may contract pneumonia. What else? Patient may, this is Kaposi sarcoma. This is a type of cancer. Okay. What else? There is this pneumocystis carinii. So these are some of the diseases that I see or I hear the patient may contract this different types of conditions that are HIV related. Okay, I'm not saying these are absolute, but I'm trying to say is that these are possible conditions that patient may contract if patient has HIV. Now, the guideline there, okay, the statement it says if the patient is admitted with an HIV-related disease, what is your primary diagnosis? Your primary diagnosis is B20. This is your AIDS code. Okay, followed by these guys here. Okay, this is your AIDS, this is your primary diagnosis. Now, after you have assigned the B20, you are to assign the code for these guys here. So for pneumonia, from on top of my head, I can remember it's G18.9. Okay, for Kaposi sarcoma, I'm not so sure about what the code is. You know, I have to look it up from the book. But what I'm trying to say here, the main takeaway here is that the sequencing rule here is that the B20 or the AIDS code should be assigned first, followed by any of these AIDS-related or HIV-related condition. Now, why is sequencing very important in the documentation? Okay, even doctors need to need to understand that. Why do we need to make sure that the primary diagnosis or the principal diagnosis is correctly assigned? The reason being is that the reimbursement to the facility, or the hospital, or the doctor has something to do with how the codes are organized. Okay, because they're insurance companies, payers, guys, look at how you organize your codes. If you're saying patient has pneumonia and AIDS is somewhere out there, you know, not even your primary diagnosis, that means to say the reason why the patient was admitted in the hospital is pneumonia. It's not about AIDS. You guys see what I'm saying here, right? Or the direction I'm going. Because the principal diagnosis, primary diagnosis has to match what was the kind of treatment that a patient received during hospitalization. And, you know, the procedure or the treatment and the diagnosis, they all need to be considered in the reimbursement. And this is the reason why it is important for for anyone out of the clinician, also the coders, especially coders, need to understand why it is important that you put the primary diagnosis in its proper ranking or proper place or sequencing. Okay, so that's what this coding guidelines say. Now, there is a condition that is an exception. Let's go back here. What is that exception? This exception, the hemolytic uremic syndrome, or HUS, that's associated with HIV. This is HIV. If this is HIV-related disease, then the guidelines said here, by the way, this is a new, in 2024, I think, a new revision of the guidelines that if a patient has this disease, this has to take priority in sequencing. I'm not going to even attempt to explain what this hemolytic uremic syndrome, but in my simple or my basic understanding of that disease, this is a disease of the small blood vessels that if not, you know, that are affected with this kind of infection, and these small vessels will eventually hurt the kidney or can cause acute kidney injury. And this is, they're saying it can lead to death if not treated right away. So, but of course, I'm not gonna even attempt to expound on that, because as it is new in the coding guidelines, that means to say they have already established that this condition is I guess more fatal or deadlier if this is the patient is coming in for, right? So that has to take place or take priority in sequencing. Let's move on to the next one. Okay, let's read here, guys. Once AIDS, always AIDS. I'm going to read. Patients with any known prior diagnosis of an HIV-related illness should be coded to B20. Once a patient has developed an HIV-related illness, the patient should always be assigned the code B20 on every subsequent admission. Patients previously diagnosed with any HIV illness should never be assigned never be assigned to R75 or Z21, asymptomatic human immunodeficiency virus infection status. Okay, let's write these codes down, guys, so we can break it down, or we can unpack this coding rule. So a lot of instructions, right? So you have the B20 here. You have the R75, and you have the Z21. Earlier in the previous slide, guys, we talked about the Z21. Z21 is for the asymptomatic HIV, right? This person does not show any signs and symptoms of HIV being active, or patient did not have any history of hospitalization because of HIV. This is more of like a healthier HIV positive person, the Z21. The B20, we all now know that this is confirmed AIDS, confirmed HIV disease. Patient had history of hospitalization because of HIV-related condition. This R75, guys, is the code for positive serology. This is the scenario where I shared with you earlier that the patient went to the doctor and tested, had a blood work, and the test came out positive of HIV. This is it, the R75. The coder for that particular encounter, guys, instead of assigning any of the Z20 or B20, will assign the R75, because this positive serology, this blood work that came out positive of HIV, needs to go to another lab, okay, to run more tests to confirm whether this is really HIV or not. Because in the outpatient setting, remember, outpatient setting, confirm only, code only confirmed cases. You cannot assign the Z21 or B20 if it's not confirmed. Okay, so I hope you guys remember that in our previous discussion. But the R75 is positive serology. Okay, so that's what the coder will have to do if the patient was tested positive of HIV. Now, let's go back to what the guidelines say. Once AIDS, always AIDS. Okay. Patients with any known prior diagnosis of an HIV-related illness should be coded to B20, which means, guys, if a patient had history of getting admitted in the hospital for any HIV-related condition, there's no question, it is already B20, because there is already a history. That's what I mean about once AIDS, always AIDS. And so far, guys, I have not heard any like definitive treatment for AIDS yet. Nothing that can eradicate AIDS completely as of this time. So if a patient had experienced HIV-related admission in the past, that means to say this follows the patient, the B20 code. That makes sense? Now, if you are the coder, once you see this HIV-related history of the patient, like patient had pneumonia because of HIV, you automatically assign the B20. Okay? Now, if a patient does not have any history of HIV, then you cannot assign this B20. HIV-related admission. You cannot assign the B20, but you assign the Z21. The key takeaway here, guys, is that especially if your role in the company is, or your role in the department is to make that confirmatory statement from the doctor, like CDIs. I am a CDI. So if there are vague statements, we don't know, we're not sure if a patient had HIV related history or no history, we normally query the provider, query the physician, and want to make sure that we would reflect in our codes the true clinical picture, if patient had AIDS or patient does not have AIDS. So what I'm trying to say here, guys, look at the statement, look at the chart. If the chart says patient had history of HIV-related condition, automatically assign this code B20. Okay, does that make sense? Because once AIDS is always AIDS. Positive serology is not AIDS. It's not HIV. Okay, so please remember that. The Z21 is HIV asymptomatic. Okay. Okay, let's go to the next slide here. There you go. Oh, this is exclusive to coders and clinicians who are doing their practice in California. Let me just read this, guys. This may not apply to you, but for people who are, or coders or professionals, practitioners who live in California, who practice in California, or even if you don't practice, but your employer is California based, this is important, guys. Please listen here. Okay, let's read. One additional caveat for assigning Z21 pertains to the state of California. Guidance set forth in California's OSHPD, Office of the Statewide Health Planning and Development, states California Health and Safety Code prohibits the disclosure of any HIV results without the patient's written authorization for each disclosure. OSPODs, or OSHPDS, warning edits are designed to protect health clients or health facilities from liability if these codes are inadvertently reported to OSHPD. Due to this guideline, facilities in the state of California have adopted a policy to omit the use of Z21 if the patient does not have an HIV-related condition or documentation started stating AIDS, then no code is reported. So you guys see this again? There is another statement here that says, unless a patient has HIV-related condition or it had already been confirmed AIDS, this code here cannot be assigned. Okay, now what does that mean? Why is that law in California? Okay, we Californians, guys, we're very patient-centered. I'm not saying that other states are not, but I'm trying to say is that we're very, very careful in implementing these rules. Even AIDS, we have rules for AIDS, specific rules for AIDS. Now, what this means, guys, is that if a patient does not have an explicit authority or permission given to the facility, okay, or signing a consent saying, hey, if I'm HIV positive, then you can definitely code it or assign that code. You cannot. Okay, you cannot, because it just makes sense to me that any patient who is suspected to have AIDS would most likely have that immediate say resolve to not declare it, right? Not unless there are exceptions, of course, but what I'm trying to say is that this is something that there is so much stigma that is attached to that disease for until now. Okay, until now, there's just so much stigma attached to it. So it is only like normal to think that any patient who is suspected to have contracted the disease would probably stay silent about it, right? Only him her or and the doctor would have that knowledge that the patient is potentially has AIDS or has HIV disease. Remember the Z21, right? There's no signs and symptoms yet. The doctor had ordered for the test. A patient may probably, suspecting that he or she might be carrying the virus. So he went to the doctor for screening. And the result probably came out, hey, it looks like positive serology. But unless the patient says, hey, go ahead, declare that I'm HIV positive, you cannot assign this code Z21. Now, what is that implication to the coders and the CDIs, the auditors, the reviewers like me? We cannot even query the provider. Hey, is the patient AIDS? Is the patient HIV positive or not? Well, we cannot send a query or ask the provider for the confirmation of that unless the patient allows or gives that permission. So that's the essence of the California law. Okay, so CDIs out there, coders, for heaven's sake, do not assign this Z21. Okay, if a patient, if the positive serology came. Okay, so that is the California law. And the exception, of course, if patient had already history of an HIV-related illnesses that a patient was hospitalized for or had been admitted into any of the healthcare facilities. And that's it, guys, for this basic AIDS rule or AIDS coding policy. I hope you guys learned something really, really important today. And again, if you have any questions, okay, any questions, comments to this lecture, guys, feel free to message me and I will reply right away to your question, okay? And if you guys haven't subscribed yet, do it now, please, okay? I mean, like this is for everybody. Share it. I mean, like and share to as many people as you can so everybody can, I mean, a lot of people can benefit, okay? That's it for today, guys. Thank you again for listening, for watching, and for any future videos. You want to make sure that you turn on that notification so I can alert you for any new uploads if I have new lectures to share. Okay? Thank you again. Stay safe and till next time.